Hello, my name is Jose Castillo. I'm going to be validating for primary IV and also IV piggyback. So the first thing we do is we verify order. So we're going to start with the primary IV. The doctor has ordered normal saline, 150 ml per hour times 24 hours. That's a total of 3,600 ml. We also need to assess for the procedural need, and we can confirm that it's the right patient, that the patient is dehydrated, and this is what he needs. We can walk into the patient's room. We perform hand hygiene. We don gloves. We make sure we have our aseptic equipment on. We need to provide the patient with privacy. Also, we need to identify the patient. So we go into the patient's wristband and we ask the patient his name and his date of birth, and we make sure the patient is the right person. Once that happens, we can actually start the patient teaching, and we can tell him that we're gonna give him normal saline via IV for 1 day, for 24 hours, based on doctor's orders, because the patient is dehydrated. He will feel no pain. This will be a pretty simple procedure. Once we do that, we can make sure that the patient is safe, that the guardrails are up in the bed, that the wheels are locked, and that everything is fine. Then we need to access the MAR and review the patient's profile. And we also need to do the medications check. In this case, it's normal saline, which is right here. We see that this is the right fluid, the right amount also. We have to check for color, for clarity, and for the expiration date, and it works. We actually have to make an actual comparison to the MAR and verify that it is the correct one. We go back into the patient's room and we check the MAR at bedside. We perform the medication checks, and in order to do so, there's 6 rights that we have to make sure we got, which is right patient, right medication, right dose, right route, right time, and the right documentation. Once we do that, we actually can go ahead and remove the primary tubing. We remove the caps, and we can actually go ahead and spike the bag right here. We hang the bag. We're gonna suppose that the bag is gonna be hanging right here. And the hang IV bag squeezes drip changer to loosen cap from the end of the tube. We have to prime the tubing. I'm gonna be using this as if it was a tubing. We have to prime the tubing, and then we hook it up with the bag, like so. Then we load the tubing into the program pump. We perform the medication checks and set the correct date. The correct rate, I'm sorry. And remember, we had said this is normal saline, 150 ml per hour. We confirm the IV site set patency by accessing aspiration blood return. So we do that on the patient. This is still my patient. We make sure that the blood returns and that everything is fine. We cleanse the injection port. Right here, a little bit of gauze with alcohol. We cleanse it. We allow it to air dry. We slowly flush with a little bit of saline to make sure there's nothing in there. We inspect and palpate site for occlusion, infiltration, or anything that is wrong. The site looks good. There's no redness, no tenderness. Everything looks good. We connect the tubing to the bag, which should be up here, supposedly, with these cables. So we connect them to begin the infusion. In order to document what we just did, we have to say the name of the drug. We said that we use normal saline. The dose was 150 ml per hour. The route is IV. Date and time is very important. So let's gonna say September 29 at 6 p.m. My initials are JAC. The patient's response to medication was fine. There's nothing wrong with the IV site. Everything looks good. Everything looked good before, during, and afterwards. The amount of the IV bag is 500 ml. And the period of time is gonna be for 24 hours. So If the bag runs out, we need to change it probably every 3 hours. And then we're gonna go straight ahead into the piggyback with the same patient. So we still started the same way. We have to verify the doctor's order. For the piggyback, the doctor has ordered vancomycin, 500 ml in 24 hours total. So that would be 20.83 ml per hour. We assess the procedural need, and we realize that this patient has a small infection. So vancomycin is what the doctor has ordered. We walk into the patient's room. We wash our hands. We don gloves. We make sure we have the right protective equipment. We do need it's an aseptic practice. We offer the patient privacy. We need to again check on the patient's identification. So what we do is we again go for the patient's wristband, make sure we ask him for his name and date of birth. In this case, for the patient teaching, we're gonna tell him that we're gonna tell the patient that we're gonna do a second IV. We're gonna use a second port for IV for a medication called vancomycin, which is for infections, and that he will feel no pain. This is a very simple procedure. Again, we make sure that the guardrails are up, that the wheels are locked, and the next thing we do is we need to access the patient's MAR. After we do that, we realize that we can that we need to perform the medications checks and review the patient's profile. Check drug and solution. In this case, is right here. There's a smaller bag for vancomycin. We make sure we have the right drug and the right solution, that everything looks good, that this is the prescribed drug, that the color, the clarity, and the expiration date are fine. We compare it to the MAR, and we realize that this is vancomycin and everything is fine. We walk back into the patient's room. We can perform hand hygiene again, don gloves, and access the MAR again at bedside. Identify the patient, meaning that we have to again ask the patient for his name, date of birth. We can use the wristband again, but we also have to make sure that we perform the 6 rights of medication administration, which is right patient, right medication, right dose, route, time, and documentation. We remove the secondary IV tubing from its packaging. We hang the bag as per facility policy. So the second bag, when we're gonna hang it, it should be higher than the first bag, because we want this to be our main bag and this to be our secondary. So this will be higher, this will be lower. I don't know if you can see it like that. This would be lower, this would be higher. That's our secondary, the vancomycin. We need to place the roller clamp in the off position. Insert the spike into the IV port right here. And that will compress the drip chamber and prime the tubing. That's what we need to do next. We hang the bag, as we said, per facility policy. We connect the secondary tubing to the appropriate port on the primary line. So we should have, the patient should have a second port where we would be connecting this one to the patient. And then we have to program the secondary mode of pump. We had said that the doctor had ordered 500 ml 24 hours, so that would be the 20.83 ml per hour. That would be the right what do you call it, when we program the pump, that would be the right time, 20.83. That's what we want to be dripping when we program the secondary pump. We again perform the medication check and set the correct rate. As I just said, that's vancomycin 500 ml, 24 hours, that will be 20.83 ml per hour. We label the bag and the line, both. The bag, if this was the line, we have to label both, the bag and the line. This will be connected right here. This is the patient. It will be on the second port. It will be connected on the second port. And then we would start the piggyback infusion. In order to document what we have just done, we have to say the name of the drug is vancomycin. The dose is 500 ml in 24 hours, and the route is IV. The date and time is very important. It will be September 23 at 6:30 p.m. My initials will be JAC. The patient's response to the medication is fine. The patient responded well to it. The appearance of the IV site before, during, and after the piggyback infusion is the same. Everything appears to be working correctly, and the period during the medication is infused, as we said, from 6:30 to 6:30 the next day p.m. because it's 24 hours what the doctor has ordered.